For bladder cancer, there's two general stages of it, and that's muscle-invasive bladder cancer and non-muscle invasive bladder cancer. And it's important because the treatment is different. Some of the symptoms with each type of bladder cancer are generally the same. The most common symptom that someone would present with would be blood in the urine, and that's either gross blood in the urine or microscopic blood in the urine where it's picked up on a urine test. Primarily for non-muscle invasive bladder cancer, we're still trying to preserve one's bladder. So the treatment includes where we instill either chemotherapy agents inside the bladder, or we instill immune modulating agents inside the bladder that actually helps to rev up your immune system to fight the cancer. For muscle invasive bladder cancer, the standard of treatment is removal of the bladder and creation of a urinary diversion. Up until about 2003, there's good evidence that shows that there's a survival benefit by giving chemotherapy to patients before surgery to remove the bladder. What you can expect with that, the chemotherapy treatment is generally anywhere from 3 to 4 cycles, so it can take about 3 to 4 months. After you've recovered from chemotherapy, then the plan is to do surgery, which would be removal of the bladder and prostate in males. In females, we remove the bladder and sometimes the uterus, the ovaries, as well as a portion of the anterior vaginal wall. After the bladder is removed, we create a urinary diversion, and that can range from creating what's called an ileoconduit, where we take a small piece of intestines and connect it to the tubes that drain the kidney, and we bring that out against the skin and it drains into an external collection device, to creating something that's called a neobladder, where we take a larger piece of intestines and we fashion it into a spear and then connect it to the remaining urethra. It would be similar to taking a tube sock and turning it into a pouch. The outcomes are fairly successful with both types of urinary diversions. Well, at Banner MD Anderson Cancer Center, we use a very multidisciplinary approach for the management of bladder cancer, where we work with the medical oncologists as well as the radiation oncologists, social workers, as well as our nurse navigators in terms of determining the best treatment route for each patient.